Am I a good candidate for a vaginal birth after I've had a cesarean section? TOLAC is a trial of labor after cesarean. VBAC is vaginal birth after cesarean. The goal of TOLAC is to have a VBAC. Other options include an elective repeat cesarean section. This is in contrast to trying labor with the goal of vaginal delivery. Some women with a history of cesarean section are good candidates for vaginal delivery, also known as TOLAC VBAC. But how do you know if you're a good candidate?
Oh, come in.
This is an example of a patient encounter.
Hi. Hi, how are you doing?
Good. So nice to see you again.
I know, I've seen you in a couple visits.
Yeah.
So I always met at the midwife.
Right. How has that been going?
Good, yeah.
Good. Very good. I'm
Getting
glad.
close now.
I see that. That's great. How far along are you now?
38 weeks.
Okay.
So, but I had a question.
Uh-huh.
I don't think we ever talked. So I had baby Harry here. We had to do a C-section, but I wanted to try and have this baby vaginally. Is that possible?
That is possible, and it's a great question. Start the conversation early. Let's try this again. Have any questions for me today?
No, I don't have anything to talk about.
Okay. Well, one thing I would like to bring up actually is what sort of options might be a good choice for you in terms of delivering your baby.
Already? I'm only like 12 weeks. Okay, sure.
I mean, I know it seems far off, but you know, with two types of delivery, you can have the natural vaginal delivery or a cesarean. But
I had that last time.
Okay.
I don't think I want to do that again though.
Okay. So what we can do is we can look at whether or not you're a good candidate for trying labor to try to have the baby naturally.
Okay.
There are certain criteria we can look at. We can see if you're a good fit for that, and then we can talk a little bit about the risks and benefits to both, because there are risks and benefits to having a second cesarean, and there are risks and benefits to having, or at least trying to have a vaginal delivery. Okay. But I think it's great for us to start talking about these things earlier so we can sort of share information. I can get a sense of what's important to you, and that way we can work as a team to figure out what's going to be the best option for you personally. Okay? Does that sound good?
Yeah.
Okay, great.
If your provider is not as proactive as mine, you should probably bring this up. It might seem early at 12 weeks, but this is something you need to be talking about early.
Decisions. How do I choose between trying for a vaginal delivery and scheduling an elective repeat cesarean? Well, an important aspect is examining the risks and benefits of each option. Review these risks and benefits with your obstetrician or provider and make the decision together as a team. The American Congress of Obstetricians and Gynecologists provides recommendations about who is a good candidate for TOLAC VBAC. The first question is, what kind of incision do you have from your prior cesarean? 1 or 2 uncomplicated low transverse incisions is fine. Another issue is making sure that you don't have any complications in your current pregnancy and that you are delivering at term. Also, it's important that you not have any contraindications to vaginal delivery. Your healthcare provider will be able to explain to you whether or not you have any complications in your pregnancy or any contraindications for vaginal delivery. You are not a good candidate for TOLAC or VBAC if you've had a classic or T-shaped cesarean incision, if your uterus has ever ruptured, or if you've had more than 2 cesarean sections. Other factors should also be considered and can be discussed with your provider. Each woman and each pregnancy is different. It is not one size fits all. Other factors may affect your chances for a successful vaginal birth, including a history of a successful vaginal birth, as well as your age, height, and weight. Studies have shown that 60 to 80% of women who try labor are able to have a successful vaginal delivery. Your provider can review your personal factors and determine whether or not you are likely to have a successful vaginal birth. So at your next visit, talk to your provider about whether or not you are a good candidate for TOLAC VBAC. Ask the provider about the risks and benefits of each type of delivery. Most importantly, make sure your provider knows what is important to you, such as your plans for future children and how you feel about the different options. If your provider doesn't offer VBAC, you should be referred to an obstetric provider who does. And if you are interested in this type of delivery and your provider recommends a repeat cesarean, you should understand why. Don't be afraid to ask questions. Both you and your healthcare provider have the same goal, that you'll have a good birth experience resulting in a happy, healthy mother and newborn baby. Thank you for your time. I hope this video was helpful to you. If you could please fill out the survey at the link below, it would be much appreciated.